Hey everyone, Roy from RAD here. Today I'm with Leo Totten, who has a ton of experience in the US weightlifting world. So Leo, can you tell us a little bit about yourself so everyone knows who you are?
My name is Leo Totten, and I'm a USA weightlifting coach and president of Totten Training Systems, where we deal a lot with Olympic weightlifting as part of strength and conditioning programs, as well as for weightlifters. And we're really happy to be partnering up with RAD. This is an awesome group here that we like to do things that are going to help our athletes. And sometimes the recovery things and the warm-up and mobility things, athletes are a little bit slacking on. And I think this is one of the things that we can really help them with. And this is a great partnership to do that.
We're going to be going over what weightlifters can do in their warm-up in order to enhance their mobility, what they can do in their cool down in order to enhance their recovery, and what kind of techniques they can do anywhere, anytime to recover faster, get back in the gym sooner, and injure less often.
Well, where do we go from here? Where do we start? I'm ready to get going.
Awesome. Yeah, so we're gonna head into our clinical setting right now, where we're gonna show everyone a lot of self-myofascial release techniques and follow-up mobility techniques to have a lasting impression on the nervous system so that mobility sticks around. And we'll see you in the clinical setting.
Roy, one of the questions that weightlifters have, and I think this is really, really important, we do a lot of stuff overhead, okay? So we need to make sure that they have the mobility to put the bar in the correct position, but then they also have to have the stability to keep it there.
Yeah.
Okay, so what we want to look for is to have the center of gravity of the bar directly in line with the shoulders through the center of gravity of the body, through that middle of the area of base. Well, if they have lack of flexibility and they're holding the bar here, then the center of gravity of the bar is forward, and that puts more stress on the whole body. We want them to be here, not here. Now you're throwing extra stress on that thoracic area and the low back. So what can we do to help that shoulder stability as well as mobility?
Yeah, great question. So we're gonna remember that this is the most mobile joint in the human body. And as a result, we really need to kind of go back and forth with stability as well as mobility, right? So this is basically the humeral head right here is like a golf ball on a tee. It can fall off at any time, right, if it's not stable enough. So we got to make sure that we're instituting on a regular basis. We want those shoulder stabilization exercises. For lifts and even activities of daily living, I like the example of reaching up for the bowl or the cup, in the cupboard, and not going into that, compensation movement pattern of using your spine, like you were saying, and putting more stress here. A lot of tissues above, below, and beside the shoulder complex have a great deal to do with how the shoulder functions. Commonly, we recommend that athletes basically test their range of motion, do a pre-assessment, do a post-assessment. So you can go in different directions. The shoulder is very mobile. For instance, if you were to say, I want to see if my biceps can reach toward my ear without me compensating, a lot of times I find my athletes actually here, and as they're raising their arm, their back starts to go into extension, and I know that their mobility is basically right here. So then it's going to be my job to look at what tissues are restricted. Oftentimes, not all the time, but oftentimes, it's the lats. They have a great deal to do with being able to go up into shoulder flexion. And also we look at the traps over here, like you were saying about people not being able to lift as much or constantly being in this position here. So we're going to look at different self-myofascial release techniques and different mobility techniques that not only take place over here in between the scapula and the spine, but we're also going to go down below the shoulder complex and look at the huge latissimus dorsi and how that can have a great effect on the amount of power you can produce, as well as having that center of gravity right above your head to prevent injury. For the shoulder, we mentioned before that the latissimus dorsi and structures above and below the shoulder complex can have a huge impact on shoulder mobility and recovery. We already took care above it with the suboccipital region leading into the upper traps. So now we're going to go below the shoulder complex and start looking at the latissimus dorsi. So Leo, can you palpate the latissimus dorsi? And that's going to be a big bulky mass right underneath your armpit. And what he's doing is he's not just palpating for no reason. He's actually trying to find an interesting spot, some people might say, or even that number 5 out of 10, or if he's like, well, that actually feels kind of good, like almost like a self-massage. That's the spot you want to line up with this recess on the RAD axle. Now from there, what you want to do ideally is try to relax this arm, put your body weight on this hand and your hips. So then there's not too much body weight here on the actual tool. If you want more body weight, you can start taking some of your body weight off your arm and place it onto this side of your body. You could also bend this elbow and hold your head up if you like. So place your hands on your head. There you go. Interesting part there is a lot of people will start digging their elbows into the ground and engage that lat. And then it might be a little bit more difficult to kind of get into and release. So ideally, if you can, release that arm back down to the ground, put your body weight over here, shift your center of gravity here and here on your hips, because less is more. We don't need to place a lot of pressure on that latissimus dorsi to get a release. We actually want just the opposite, right? So if that's a good spot, I always recommend everyone to take at least 3 deep breaths to down-regulate that nervous system. Even if this is a warm-up, that will help release the tissue and help you mobilize it during your warm-up. If this is recovery, just doing this right here, called a pin and hold, it can actually really help squeeze out those inflammatory molecules that you just generated during your workout, thereby enhancing the recovery time. So that's first. If Leo wanted to, let's say this is the warm-up, and he really wants to focus on more mobility here, maybe get more shoulder flexion for that lift, I'm gonna recommend that he shears across to get those tissues sliding and gliding. So yeah, exactly. So you're gonna lift your chest toward the ceiling and then toward the floor. And he's only rotating just a little bit because he just needs a little bit of that tissue, or I should say the tissues, to go a little bit side to side, okay? Now, as long as you feel that shift of the tissue, you're doing it right. Last but not least, he could also go into miniature flushing. So maybe 4 to 8 inches long. And again, less is more. He does not need to place a lot of weight on that area. If 10 is pain, he wants to be roughly around that number 5. And notice how slow he's going. That looks awesome. And as long as you're breathing and that's not feeling painful, this is what it could look like for you guys. So how is that feeling right now as far as intensity and relaxation versus pain?
I'd say we're at about a 5 or 6.
Perfect.
Exactly where I want to be. It does feel really good.
Awesome.
Feels loose already. As I sit up, I can feel the difference. And from a weightlifting perspective, I want to be able to have those lats loose to be able to receive the bar in the correct position, whether it's a clean or the front squat or anything overhead. If those lats are loosened up, it allows me to put the bar in the right position. So I can feel the difference. Can I do the other side now, please?
All right, Leo, what are we going to follow up with after every self-myofascial release technique?
Got to do some mobility stuff.
Mobility, man. Educate the nervous system. So really, really simple. What I want you to do is just relax your arm and your hands by your hips. And all Leo is going to do is, let's just take one side at a time. So you're going to go your left side since you just hit your left lat. And all I want you to do is glide your arm slowly across the floor as you take a deep belly breath in. And you're gonna reach as far as you can, like there's something behind you. Reach, really elongate right here. And then on your breath out, nice and relaxed, start bringing that hand down toward your hip. And I would recommend doing that a minimum of 5, if not 10 times. So one more time, do that. And what's happening here, folks, is as he's going up, it's educating the nervous system on how much more mobility he actually has in these tissues now in the frontal plane of motion. And then from here, he's gonna totally relax the lat here, again to prove to the nervous system that you can actually relax that tissue. Now another plane of motion, go back up nice and slow, take a deep belly breath in, and now instead of going down the way down you did before, you're gonna bring your elbow to shoulder level and then stop and then internally rotate, bring your palm toward the floor, and then continue on that path. Nice. And now you can do the opposite, where now you can bring your elbow up, bend your elbow to shoulder height, and then palm up, externally rotate, and then back up to the sky. Yeah, awesome. So now we're adding a little bit of rotation into the shoulder complex, because as we know, shoulder is a very mobile joint, and it should be able to move in all planes of motion.